Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, how does narcissism manifest in borderline personality disorder? To help answer this question, I'll be using an article published in 2017 by Euler and colleagues, and I'll put the reference to this article in the description for this video. So first I'll take a look at borderline personality disorder, then the construct of narcissism, including narcissistic personality disorder, and then talk about the manifestation of narcissism in borderline personality disorder. So with borderline personality disorder, we know this is a cluster B personality disorder in the Diagnostic and Statistical Manual. So it's in the same cluster as antisocial, histrionic, and narcissistic personality disorder. This cluster is the dramatic, erratic, and emotional cluster. So with this disorder, we see 9 symptom criteria: frantic efforts to avoid abandonment, an unstable relationship pattern, identity disturbance, impulsivity in at least 2 areas that could be self-damaging. We see suicidal behavior, threats, ideations, gestures. We see affective instability, a chronic feeling of emptiness, intense inappropriate anger, and paranoid ideation or dissociation. We also see some other clinically important characteristics associated with borderline personality disorder. For example, it tends to be comorbid with depression, substance use disorder, and the other cluster B personality disorders. We also see the severity of borderline personality disorder can vary quite a bit, and of course, certain symptoms may not be present in certain manifestations of the disorder. Only 5 symptom criteria are required for a diagnosis, so there are a number of potential patterns, a number of different combinations of symptom criteria that could result in a diagnosis of the disorder. Now, another associated characteristic of borderline personality disorder is a high rate of co-occurrence with pathological narcissism. And as I mentioned, borderline personality disorder can be comorbid with other cluster B personality disorders. One fairly common combination is borderline personality disorder comorbid with narcissistic personality disorder. And in clinical treatment settings, this particular combination is considered particularly difficult to treat. Now, the concept of pathological narcissism is a bit different than the diagnosis of narcissistic personality disorder. So first I'll talk about narcissistic personality disorder and then talk about pathological narcissism. So narcissistic personality disorder, I'll refer to this as NPD, also has 9 symptom criteria in the DSM. We see a grandiose sense of self-importance. We see someone who has a lot of fantasies about wealth and power. They believe they are special or unique. They require excessive admiration from others. We see a sense of entitlement, a tendency to exploit other people interpersonally, a lack of empathy. We see an envy for other people and a belief that other people envy them. And we also see arrogance. Now, the construct of pathological narcissism is an area that's researched. It's research around narcissism that can cause distress, but it doesn't overlap perfectly with narcissistic personality disorder. There are really 2 factors to pathological narcissism. There's a grandiose narcissism and a vulnerable narcissism. The grandiose narcissism does align fairly well with narcissistic personality disorder. We see overlap in areas like the grandiose sense of self-importance, the fantasies of success and power, the sense of entitlement, exploiting others, and that envy component. Now, the other factor in pathological narcissism, as I mentioned, is vulnerable narcissism. And here we see characteristics like being socially withdrawn, having mood lability, being self-critical, having a sense of inadequacy, being sensitive to rejection. This is sometimes just called rejection sensitivity. We also see a low level of self-esteem and high levels of shame. So when we take a quick look at pathological narcissism, we see the grandiose narcissism lines up again with NPD, and it looks like the vulnerable narcissism seems to have a lot in common with borderline personality disorder. We see more evidence to support this relationship when we look at the associated characteristics of vulnerable narcissism, including impulsivity, a tendency to be depressed, and anger. We also see other characteristics like a contingent self-esteem, meaning somebody's self-esteem tends to fluctuate depending on how people are treating them. We also see this idea of concealing faults and devaluing other people, tending to have a disdain for others that do not supply admiration to an individual. So again, looking at all these characteristics associated with vulnerable narcissism, we do see this connection to borderline personality disorder. So with all this in mind, this particular study I referenced before really wanted to look at the relationship between narcissism and borderline personality disorder, specifically how narcissism manifests in that disorder. So this study included 65 participants, 50 were female and 15 were male, and all were over the age of 18, and all had a diagnosis of borderline personality disorder. So there were some interesting results from the study. We saw here that the males had significantly higher scores for total narcissism, so that's the entire construct of pathological narcissism, grandiose plus vulnerable, and they also had significantly higher scores for grandiose narcissism. 40% of the males had co-occurring narcissistic personality disorder, and only 8% of the females had that same comorbidity. Males also scored higher on vulnerable narcissism, but not statistically significantly higher, and this particular finding is contradictory to what we see in earlier research. So with the small sample size of the study and this contradictory finding, I'm not sure how confident we can really be about this particular finding. Another finding here was that the males had more subclinical narcissism than the females. So this would be narcissism that would not rise to the level of pathology. Also in this study, a finding that wasn't particularly surprising was that vulnerable narcissism was associated with the borderline personality disorder criteria, those symptom criteria I read before. And we also see that grandiose narcissism was associated with the criteria for narcissistic personality disorder. More depressive symptoms were observed in the individuals with vulnerable narcissism, and fewer depressive symptoms observed in the individuals with grandiose narcissism, and we see the same thing with rejection sensitivity. A higher level of rejection sensitivity was observed in vulnerable narcissism and a lower in grandiose narcissism. So these results can lead to a few different theories. We can learn a lot from this study. One theory is that grandiose narcissism may be a protective factor. Individuals with grandiose narcissism may be able to better cope with symptoms. They have lower symptom distress. Now it's important to recognize, though, that this protective function wouldn't be adaptive because there are still difficulties associated with grandiose narcissism. It would simply offer some protection from distress. Another theory that comes out of these results is this idea that vulnerable narcissism may be missed by clinicians who are conducting assessments. And they also may misdiagnose vulnerable narcissism as borderline personality disorder. This idea is supported by what we see in clinical practice. Narcissistic pathology is fairly common, but the diagnosis of narcissistic personality disorder is not as common. So there seems to be a gap there, and it could be explained by this idea that vulnerable narcissism is being missed. So one way we could look at pathological narcissism, in addition to this grandiose or vulnerable model, is that it has two factors in terms of diagnoses. We have NPD and borderline personality disorder. Now again, these constructs don't align perfectly with grandiose and vulnerable, but this is an interesting conceptualization of pathological narcissism. And one last interesting theory that comes from these results is this idea that we see in prior research about how grandiose narcissism tends to fluctuate. So grandiose states can move into vulnerable states, and vulnerable states can move into grandiose states. This idea that pathological narcissism isn't stable, that it moves between the grandiose and vulnerable states, is actually fairly consistent with what we see with borderline personality disorder. Borderline personality disorder has affective instability, identity disturbance, the unstable relationships, and anger that tends to come and go. So just more evidence that supports there might be a relationship here between vulnerable narcissism and borderline personality disorder. So taking a step back and looking at this study, we again see, as we do with many studies, that we need to be careful in assessment, and we need to understand the nuances of these various constructs and make sure that we are asking the right questions and paying attention during the assessment phase of treatment. I hope you found this description of narcissism and borderline personality disorder to be interesting. Thanks for watching.